Well, here's a new one. A new toothpaste could help adults with peanut allergies. It's the result of an early stage clinical trial that could help the millions of people in the U.S., 4.5 million, who suffer from a peanut allergy. Dr. Reena Mehta from Uptown Allergy and Asthma joins us with a closer look at that. Good morning to you.
Good morning. Thank you for having me.
Tell me about this toothpaste.
Yeah, it's such a cool idea, right? So we have lots of patients with peanut allergy. Pediatric patients, adult patients. And really with peanut allergy, up until recently, it was avoidance. Well, the concept of this toothpaste is basically, can we desensitize patients to peanuts by using toothpaste? So there's a lot of immune cells in the mouth, in the gums. And so if you're brushing your teeth with a toothpaste that may contain a small amount of peanut protein, the thought is that it's called oral mucosal immunotherapy. So therefore your gums would actually absorb the peanut protein and hopefully lead to some desensitization.
Or omit. I like the abbreviation.
Exactly.
A little bit. So they would increase the amount of the protein, the peanut protein, over a period of time?
Exactly. So this was a phase 1 study, very small, with 32 adults. And what they did was, over a period of 11 months, they had these patients using this toothpaste that had peanut protein. And they started with micro doses, and then over an extended period of time, they increased the dose of the peanut protein in the toothpaste, so that by the end, the patients were using 1/3 of a peanut kernel in the toothpaste.
Which can be, normally, that could be a big problem.
Exactly, exactly.
So the thought now is they'll bring it to children, to a trial?
Exactly. So the point of this trial was looking at safety. And so they wanted to say, okay, is this a safe thing to do? And they found that it was very safe. All of the patients completed the trial, and there were no serious side effects or no adverse reactions, maybe a little bit of mouth itching and things like that, but nothing that couldn't be overcome. And so now the FDA has approved a study to come out in pediatric patients ages 4 to 17, where then they'll try to use the toothpaste to see if they can desensitize.
There are more treatments on the horizon?
Absolutely. So now we are doing all sorts of kinds of peanut desensitization. We do something in my office called oral immunotherapy, where we're actually having patients who are allergic to eat peanut protein over a period of time. So the nice thing about the toothpaste idea is, like, it's very fearful to eat this protein. It's, people get nervous about it. You don't have to get a shot. So the thought about the toothpaste is it's very easy to do. That being said, we do oral immunotherapy. There's thoughts of doing sublingual immunotherapy, where you can actually put the protein underneath the tongue for absorption. And now there's studies looking at a peanut patch, where you actually wear a patch on your skin that actually allows you to absorb some peanut, with hopes for desensitization as well.
And both enjoy peanuts and at the same time not get in a situation where, oh no, there were nuts in this and we didn't know.
Yeah, I mean, the hope is that we're trying to prevent anaphylaxis and severe allergic reactions, so that you can raise that threshold for a major adverse event to happen if you ingest something with peanut.
Okay, I think we'll have you back to hear how things